2 lines on a test, and then 40 weeks of the same questions. When is my anatomy scan? When is the glucose test? When do I tell our? Today we map all of it onto one calendar. And the cadence you will hear most is 40 weeks, 14 visits. Picture the first weeks after a positive test. The office hands you a little appointment card with just your next visit on it. But your head is already running the whole year. When is the next scan? When does the glucose test happen? What week am I even in? One card, 40 weeks of unanswered questions. These are the questions that loop every single week. How big is the baby now? When is my next appointment? Should I do cell-free DNA? When does the anatomy scan happen? And almost all of them trace back to one starting date. That starting date is different for everyone. It might be the first day of your last period, or the day you ovulated. And if you conceived through IVF, it is the day of the embryo transfer. Which date you have decides which formula gives your due date. Let's start with the standard US method. It is called Naegele's rule. Take the first day of your last menstrual period, the LMP, and add 280 days. That is your estimated due date. One number to remember today, just 280. But the LMP method makes one big assumption. A textbook 28-day cycle, with ovulation on day 14. Real cycles vary. So a plus or minus 2-week range is completely normal. The due date is a target, not a fixed appointment. What if your dates are fuzzy? This is where the first trimester ultrasound takes over. Done between 8 and 13 weeks, it measures the length of the embryo and dates the pregnancy with under 5 days of error. ACOG calls this the most accurate method. If the scan and your LMP disagree by more than 7 days, the scan becomes the official due date. If you tracked more closely, you can be more precise. Ovulation date adds 266 days. An IVF day 3 transfer adds 263, and a day 5 blastocyst transfer adds 261. IVF is the most precise of all, because the lab documents the date to the hour. The good news, you do not do this math by hand. The PiPi World's pregnancy calculator supports all 3 starting points. Pick your start, click one date, and it instantly shows your gestational age, your due date, AD-day countdown, and your progress percent. All of it in 1 second, no sign up. Here is the part most parents end up loving. Below the result, a market-specific prenatal visit schedule card appears. Every visit, every test, laid out from the exact date you entered. No more guessing when each appointment is due. So what does that schedule actually look like? It follows the ACOG standard cadence. Monthly visits through 28 weeks. Then every 2 weeks, from 28 to 36. Then weekly, after 36. That works out to about 14 visits, for a low-risk pregnancy. Let's walk the timeline from the start. Your first prenatal visit lands at 8 to 10 weeks. This is the big one. It confirms the pregnancy with a dating ultrasound, checks your blood type and Rh factor, and runs the first round of blood work. Call your provider as soon as you get a positive home test. Now one test that confuses almost everyone, cell-free DNA. In plain terms, it is a single blood draw from you that screens the baby's chromosomes for conditions like Down syndrome. You can do it from 10 weeks onward. And it is also called NIPT. Just how reliable is it? For Down syndrome, also called trisomy 21, cell-free DNA has over 99% sensitivity. And here is the update worth knowing. As of 2020, ACOG recommends it for all pregnant patients, not just high-risk ones. The catch is cost, because insurance coverage varies. If it is not covered, out-of-pocket can run anywhere from $200 up to $2,000. So before you order it, make one quick call to your insurer. It can save you a real surprise on the bill. One thing to be clear about. Cell-free DNA and the first trimester screen are screening tests, not diagnostic ones. A positive result does not confirm anything by itself. It is confirmed later, with amniocentesis or with CVS. Screening tells you the odds, diagnosis gives the answer. Now we reach the appointment everyone counts down to. The anatomy scan. It happens between 18 and 22 weeks. And for many parents, this is the visit where it all becomes real. It is also where you can usually learn the baby's sex. This is the level 2 ultrasound, the most detailed of the pregnancy. Over 30 to 60 minutes, the sonographer checks the brain, the face, the heart's 4 chambers, the spine, the kidneys, bladder, stomach, and limbs. About half of major structural issues are first caught right here. Next on the calendar, the glucose test, at 24 to 28 weeks. In plain terms, this checks whether pregnancy is affecting how your body handles sugar. In the US, most practices use what is called the 2-step approach. Here's how the 2 steps work. Step 1 is the 50-gram challenge. You drink a glucose solution, wait 1 hour, and give a single blood draw. No fasting needed. If you do not pass step 1, step 2 is the longer 100-gram test, with an 8-hour fast, and 4 blood draws. How common is the diagnosis it screens for? About 7% of US pregnancies are diagnosed with gestational diabetes. And the first line of treatment is reassuringly simple. It usually starts with diet and home glucose monitoring. Only some patients end up needing insulin, a quick one that is easy to forget. Between 28 and 36 weeks, you get the Tdap vaccine. It is not really for you. It is so your newborn gets whooping cough antibodies passed across before birth. One shot, protecting a baby who cannot yet be vaccinated. Almost at the finish line now. The Group B streptococcus test comes at 36 to 37 weeks. It is a simple swab. And about 25% of women test positive. If you do, you get IV antibiotics during labor, which protects the newborn from serious infection. But why test so late, at 36 weeks? Because Group B streptococcus colonization can come and go. A test at 28 weeks might not reflect your status at delivery. The 36-week window catches it close enough to labor to be reliable, while still leaving time for results. Now let's switch from the exam room to your job. US maternity leave is a patchwork, and there is no federal paid leave. So the planning is on you. And it starts with one law everyone should know, FMLA. FMLA stands for the Family and Medical Leave Act. It gives you up to 12 weeks of unpaid, job-protected leave per 12-month period. You qualify if you have worked 1,250 hours over the past year at an employer with 50 or more employees within 75 miles. Unpaid by default, but your job is protected. So how do parents actually get paid time? You stack the sources. A handful of states, like California, New York, and New Jersey, offer paid family leave. Short-term disability often covers 6 to 8 weeks after birth, at partial pay. Add saved PTO on top to stretch the total. And when do you actually tell HR? The common advice, notify them around 20 weeks. So they have time to plan your coverage. Your medical provider certifies the dates. If you walk in already knowing your due date and your projected leave start, that conversation is 5 minutes, not 30. Let's come back to the screen you will look at most. The weekly fetal development card. Based on your start point, it shows this week's size and milestones. At 20 weeks, for example, the baby is roughly 25 centimeters and about 300 grams. The carousel runs from 4 weeks all the way to 40. Most parents screenshot that card and text it to their partner every week. And the schedule itself is just as easy to pass along. The tool builds a share link. So the link reproduces the exact same screen. Your partner sees the identical result. No retyping, no confusion. And because this is sensitive health data, privacy matters. The whole tool runs inside your browser. The dates you enter never leave your device. Nothing is sent to a server. If you are curious, open the network tab and watch. You will see 0 outbound requests when you submit a date. One principle stands above the whole calendar. This tool gives you general information and a working schedule. But your individual plan depends on your health history, your risk factors, and your provider. Use the calendar to plan the days in between. And let your obstetrician make the real calls. Let's lock in the dates worth remembering. First visit at 8 to 10 weeks. Cell-free DNA from 10 weeks. Anatomy scan at 18 to 22. Glucose test at 24 to 28. And Group B streptococcus at 36 to 37. 5 windows, and the tool lays them all out for you. 40 weeks is a long road, but one calendar makes it feel short. Pick your start point, enter one date, and every visit lines up in front of you. Map your 40 weeks now, in 1 second. See you in the next video.